Imagine waking up. You reach for your phone like you do every single morning, but this time you can't see the light from the screen. So you cover one eye, then the other, and a wave of panic hits you as you realize the vision in one of your eyes is just gone. This isn't a nightmare. For a lot of people with multiple sclerosis, this is a terrifying reality, and it's how this journey begins.
Just think about that for a second. That's a direct quote from a patient. It's that moment of pure, gut-wrenching panic. A sudden, totally unexplainable blindness that happens in the time it takes you to wake up. Your whole world just changes in an instant.
And it didn't stop there. For another patient, the day started with things just looking a little fuzzy on their computer screen at work. But then, within a few hours, their peripheral vision started to just disappear. Huge black shadows crept in, and they said it felt like their vision was literally closing in on them, like they were looking through a dark, shrinking tunnel. By the very next morning, 90% of their eyesight was gone.
So what on earth is happening inside the body to cause something so dramatic, so fast? Well, these terrifying experiences are caused by a sudden attack on the optic nerve. The condition has a name: optic neuritis.
So, clinically speaking, optic neuritis is an inflammation of your optic nerve. But here's the really crucial part to understand. The optic nerve isn't just some wire that connects your eye to your brain. It's actually part of the brain itself. And that right there, that explains why it's so frequently hit by MS, which is a disease that goes after the central nervous system.
And that connection is incredibly direct. In fact, for a full 20% of people who eventually get diagnosed with MS, that's 1 in every 5, optic neuritis is the very first symptom they ever have. It's often the wake-up call that leads them to a diagnosis in the first place.
And if we zoom out and look at the bigger picture, the numbers are even more stark. Up to 80% of all people living with MS will have some kind of vision problem during their lifetime. And optic neuritis, it's the most common one. This isn't some rare side effect. It's a core part of the MS experience for so many. These are the classic signs that doctors are looking for. You've got the sudden blurriness or vision loss, of course, but patients also talk about this really distinct pain when they move their eye. And colors can look dim, kind of washed out. You can see how this lines up perfectly with what those patients described, right? That tunnel vision, those black shadows creeping in, it's all right here.
So how did the specialists figure this out for sure? Well, if you go to a neuro-ophthalmologist, they're going to run you through a whole battery of tests. They'll check your vision and your color perception. They'll use this special microscope, a slit lamp, to get a good look at the front of your eye, and then they'll dilate your pupils to see what's going on in the back. They'll test your peripheral vision, and they use this really advanced imaging called OCT to get a super detailed picture of the optic nerve itself.
Okay, so once that diagnosis is confirmed, the clock is ticking. The focus shifts right away to treating this acute attack, and that involves making some really critical choices, and fast.
Now that is the voice of experience. Patients who've been through this, they know the drill. Your first call is to the neurologist. And the first line of defense, almost every time, is a course of high-dose steroids to knock down that inflammation. But, and this is a really important but, you have to understand what the steroids are actually for. Their main job is to speed up your recovery. They help you get better, faster. What they don't necessarily do is change how much vision you'll get back in the long, long run.
And this is where the story gets absolutely fascinating. There was a huge landmark study called the Optic Neuritis Treatment Trial, or ONTT, and it came back with a finding that shocked everyone. They compared high-dose IV steroids, low-dose oral steroids, and a placebo. The IV steroids worked as expected. They sped things up. But the group on low-dose oral prednisone, they had double the risk of having another attack in the future. Doubled. I mean, that one finding completely changed the game for how doctors treat this.
So you treat the attack, but the journey is far from over. Recovery, well, that can be a long, slow road. And the experience itself leaves a pretty deep emotional mark.
So, what does that recovery actually look like? Well, you have to be ready for a marathon, not a sprint. Some vision might start to come back within a few weeks, which is great, but for a lot of people, it can take several months to see a real, significant improvement. And for some, that process of getting as much vision back as possible can take up to a whole year. Patience is a huge part of the healing process.
And we really can't overstate the psychological side of this. As this patient puts it, losing your sight, it can be the single most emotional, devastating part of having MS. Think about it. It affects your work, your independence, how you connect with the world around you. It's a loss that just cuts incredibly deep.
But in the middle of all that fear and uncertainty, there is a very, very important and reassuring piece of data. The numbers show that the vast majority of patients actually recover their vision really well. In fact, only about 3% of people who have an attack end up legally blind from it. So while the journey is absolutely terrifying, the outlook is, thankfully, pretty positive.
But recovery doesn't always mean a perfect return to the way things used to be. For a lot of folks, it means learning to live with a new normal, adapting to lasting changes in their vision.
A perfect example of this is something called Uphoff's phenomenon. Sounds complicated, right? But what it means is that after you've recovered, you might notice your vision gets blurry whenever your body gets hot. From exercise, a hot shower, or just a hot summer day. The signal from your eye to your brain gets a little fuzzy, temporarily. The key thing here is that it's not causing permanent damage. It's temporary.
But even if it's not damaging, the real-world impact is huge. Just listen to that. Missing your son's football game? Not because you're sick, but just because the summer heat will literally make your vision blur out. It's this constant negotiation you have to have with your own body and your environment.
So in the end, it really all comes down to adaptation. It means learning new strategies, like taking frequent breaks from the computer screen, or cooling yourself down the second you feel overheated. It means using every tool you can get, from low vision specialists to tech like iPads and magnifiers. And most of all, it means being vigilant and calling your doctor the moment any new symptoms pop up.
So after the attack, after the treatment, after the slow recovery and learning to adapt, what's left? For so many patients, it's this one powerful, lingering question. It's about the future. It's about what it means to age with a chronic illness. And it's just a powerful reminder of the incredible resilience it takes to live with MS day in and day out.